Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to journalist Ryan Pryor and Kim Knokstad, who served as the White House's first director for disability policy from 2021 to 2022, about holes in the nation's plan for dealing with the long-term effects of COVID and how the government needs to do better for the sake of health, safety, and the economy. Let's listen.
Kim Knokstad and Ryan Pryor, thanks so much for joining me.
Thank you for having us.
Happy to be here. Today, I'd like to talk to you about Biden's National Action Plan for longer-term impact of COVID. Kim, could you tell me what is it and where is it lacking?
Yeah, absolutely. So earlier this month, President Biden and the Department of Health and Human Services, or HHS, we'll probably say throughout this time together, released actually two reports from a presidential memorandum earlier. Here is the path forward on long COVID. So one of those reports was we'll call it a laundry list of services that the federal government can provide if you have long COVID. The other is a national strategy on research to move forward on long COVID. The presidential memorandum from I believe it was April, really set forth, and it was supposed to kind of coalesce around a couple areas and set a path forward for kind of a whole of government approach to long COVID. These reports were supposed to be the next step. And to be honest, having worked on this when I was in the administration, I really would have loved to have seen more. I think these reports are a really great start, but I think what is needed is it's more than just saying, here are the services and here is the plan for the research. I think what we were wanting is a little bit more meat on the bones, right? We were wanting to say, okay, now how are we actually delivering these things? We now have a lot of people with long COVID. The CDC is reporting 1 in 5 people who get COVID have long COVID, and adults, I should say. And that's a lot of people. And so I think people are like, great, we need a list of services. This is helpful, but then what? And so I think that's where things just, fell a little short of what we were really wanting to see. And again, I don't want to overly criticize because I think these reports were needed, but it was what's next? I don't know if Ryan, you want to add to that too?
Yeah, I just think that it's necessary to lay the foundation, and that it is good groundwork and good work by the administration to showcase what's ongoing right now. But long COVID represents a mass disabling event, and so these up to 1 in 5 people who get COVID have long-term symptoms. So it's important to see this as a disability that it really is, which means that it will not just simply go away for a lot of the people who have long COVID. And so there will be tremendous effects on the economy going forward if it's not addressed. So there's a real opportunity to dream big, to do a sort of a moonshot approach to really say that we have an opportunity to accelerate drug repurposing and to aggressively pursue randomized clinical trials to cure, not just to treat, but maybe even to cure long COVID. And in that process, it's an opportunity to probably make major inroads on how we treat chronic fatigue syndrome or myalgic encephalomyelitis, and a long list of other post-viral diseases that have been around for decades that we know are the results of the downstream effects of viruses. And now we just see this scaled up tenfold. And so the administration ought to consider a much more aggressive approach on long COVID.
Well, that was my question, Ryan. It's, we're 2.5 years into this pandemic, and it feels like people still aren't believing those who say they have long COVID. And it feels like we're not really considering them. Should we have started this a long time ago?
And there are processes that are ongoing so far. That there's a $1.15 billion recovery initiative through NIH that the appropriations are made at the end of 2020, and then that trial and it's not really trials yet, but the initial multi-site study started beginning in 2021. So there have been things that are in process, and they are going faster than they normally would by NIH standards for standing up a large initiative of this type. But for the people who have long COVID, especially those who've been disabled and can't go to work and can't go to school because their symptoms are so debilitating, it's going way too slow. So it's going, in some ways, it's going faster than normal. But it's at the rate that the NIH is going in researching long COVID, there may be solutions in a decade or more from now. It would be great if those solutions, were proffered in the next 1 or 2 years. And so, any process that we can think of to accelerate that discovery and that drug repurposing would be very helpful.
Kim?
Yeah, and I think what's important here too is we have a large chronic illness community, and something I'm a part of. Something Ryan and I share. And I think that's something that we're bringing a perspective to, because we've fought for so long to find doctors that listen to us and believe us when we come to them with symptoms. And for me personally, it was most of my life actually trying to just figure out what was wrong. Why were these problems? And so I think that's what we're seeing now. So many folks with long COVID going through. And it's, I think if we can find a way to accelerate some of this work, it may actually bring a different perspective and even bring new solutions to those of us with other chronic illnesses. And even like the mRNA vaccines have brought new solutions to those with chronic illnesses to even get vaccinated in a different way. And so when we see a big acceleration, we see benefit across a variety of different, avenues. So I think that's something that is really important to think about too. And so we see the chronic illness community kind of wrapping around the long COVID community, saying, you are being gaslit by your doctors, but here's how to navigate it. Here's how to navigate the insurance company, all of these different things, and let's work together. But I think it's important perspective to think about as well.
Kim, are there any steps that could be taken sort of right now that aren't being taken?
Yeah, as Ryan pointed out when we kind of first started, I think actually viewing long COVID through a disability lens is really critical. And to be honest, that's actually how a lot of the long COVID work started with the administration. The first announcement, public announcement on any action for the federal government on long COVID was actually regarding disability. And so keeping that disability lens on the work provides rights, it provides access, and it gives a different frame to long COVID. That was a little bit lost in these two reports that came out. And so I think actually bringing that disability lens back to the work is really important as we move forward. Again, that gives rights to work, to education, to a number of different pieces, and actually in healthcare as well. And again, keeping that connection to other chronic illnesses is really important. And then really thinking about, bringing in a patient-centered approach and taking those perspectives all together. And then as we've been talking about, really accelerating this work, we need this driving from the White House across agency effort. We need to actually accelerate this work in a really meaningful way, and not just letting it kind of stop and halt, and actually putting it at the center of what we're working on.
Ryan, this disability question is very interesting. I think nobody really grasps yet sort of the impact that this is going to have, not just on individuals' health, but sort of on the economy, on employment. Can you talk a little bit about that?
Yeah, there's a new report out this week from the Brookings Institution that says, maybe edit this out, I'm trying to recall exactly the number, $170 billion impact on the U.S. economy so far. One aspect of that report from Brookings was that between 2 and 4 million U.S. workers are potentially currently out of work because of long COVID. And what that we know we have a labor shortage that's been making a lot of headlines for the past year, and what that translates into real numbers of how is long COVID contributing to the labor shortage that's very real threat for our economy is that that could be between 10 and 30% of the labor shortage could be attributable directly to long COVID. So you're seeing this in a macroeconomic way. Maybe one of the most obvious impetus for why we need to move much more quickly on long COVID. And one other note that I want to make sure that we incorporate into this is that there's dozens of scientists from a host of world-renowned institutions, Stanford and Harvard and Columbia, who have decades of research experience working on post-viral illnesses. And some of those world-leading scientists have not been incorporated into the Recover Initiative process via the NIH. And that's been a real sticking point for patient advocates who know these researchers, especially parts of the ME/CFS community who've helped fundraise for these researchers to get them for the potentially life-changing treatments that they might be able to offer if given support for their research. If we were to engage in a more patient-centric model and then into a model that incorporates what's already quite well known about post-viral illnesses, I think we would make significantly more progress in the next year on how we can help people long COVID.
And Kim, let me give you the last word.
Oh, yeah. I think that economic case for why this is important is something just to really emphasize. I mean, that Brookings report, Ryan and I have spent a lot of time thinking about long COVID in recent months, and just seeing that number and seeing the impact on our economy right now is really overwhelming. And I agree. I think it really makes the impact that this is an immediate and urgent need. And it's not that people with long COVID can't always work, but it does mean that work might need to be a little bit different. And again, that's where that disability lens comes in. It also might mean, our social services and public benefits need to be more accessible. But at the end of the day, if we're not actually addressing this with a whole of government and accelerated approach, then none of it is going to work. And we're going to continue to have more and more people exiting the workforce and not actually being a part of our economy in a really significant way. So again, this is an economic case that is incredibly important, and it also adds the front end of how do we prevent it. We get that question a lot of what are we doing? Well, we need to continue the things that we know work to not get COVID at this point until we know more about long COVID. So that's another piece that we should add as well.
Kim Knoxted and Ryan Pryor, thanks so much for joining me.
Thanks for having us.
Thanks for having us.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.